Welcome back to the big fight. So, certain spike we're seeing in certain pockets of COVID-19, and amid all of this, there is a growing concern as to why we are not vaccinating enough. Are we now reaching a position where from vaccine hesitancy, we are going into the vaccination process hesitancy? But what about the whole process? To discuss the process, we have with us the chair of the Empowered Panel on COVID-19 vaccination, Mr. Sharma. Dr. Sharma, thank you so much for joining us on NDTV. My first question to you is, the Health Ministry says that there is a sort of a cutoff for all the health workers for the vaccination to be completed by the 6th of March. Am I to assume, Dr. Sharma, that you shall be prepared for a rollout of the next phase by the 7th of March?
Yes, Sanket, first of all, the question relating to numbers, etc., I will not be able to answer.
Sure,
because my job is essentially to ensure that there is a robust technology backbone which will support the vaccination and at a scale, and to that I can say that the backbone is absolutely ready. And we will be able to take any numbers which may come to the system. Let me also say that the approach will be, people-centric, as I had said some time back to your channel, that people will be able to, make an appointment, register themselves on the system, and then choose a center of their choice for vaccination and choose a date of their choice. So it is going to be, quite different because currently we have the health workers and the frontline workers who are essentially like a captive audience. So we had their data, and then we were inviting them, and they were coming, and things were happening. Now, when it goes to the population scale, then the approach will be quite different.
Dr. Sharma, would you like to tell us what the approach is going to be? We have a rough idea of what you told us last time around, but there are growing concerns of this process being painfully slow.
No, this process will be painfully slow. It is a very simple process where you will be able to register yourself on Aarogya Setu app or through call center or through portal. There will be multiple channels through which you can make appointment, and thereafter you can schedule your appointment also on the centers near you. And once you go to the center, then you will have to obviously authenticate your identity and your, of course, the eligibility criteria, whatever the government keeps, and which is whether people with the age of 50 or more, or people with age 60 or more, whatever the criteria is, you have to satisfy that criteria. And obviously that will be satisfied by either you produce a driving license or a passport or an Aadhaar, which all these documents have your age proof, your name and other things. So that will be your authentication process, and then you will be vaccinated.
But Dr. Sharma, when is this going to begin?
The certificate will be issued after each vaccination.
Dr. Sharma, when is this process going to begin?
That question, as I said to you, is, as I said, this is not, this is not my domain, so to say. I am responsible for technology, and I have built that system. Whenever the government
Dr. Sharma, then let me frame my
decides
question
that
in a
this is the
different
date
way.
from which.
Yeah, let me frame my question in a different way.
Yes, please.
How soon do you think your system or your backbone or this technological mechanism will be ready to deliver on this challenge when it is thrown open for everyone?
It is already ready. It's absolutely ready. That's what I was saying to you, that this thing is ready, and we are doing the internal testing of all these sort of systems. For example, there are 3-4 components of this system, if I can kind of briefly describe. One is the system of appointments and scheduling. Another is the system of facility management, whereby the facilities will be able to manage their timetable of the vaccination, their capacity of the vaccination. And the third is essentially the verification and vaccination at the point of vaccination site. And the fourth is issuance of the certificate after the first vaccination, first dose, and then finally after second dose. All these four components are ready. Two of them are already functioning, which is the verification and the certification, and the other two are getting, they are ready, and we are testing them in-house.
Sure. But Dr. Sharma, I'm sure you're aware, and you answered this question last time also, on glitches that existed in the system. Whenever there is a new system, there are certain glitches. What is the position right now? Because even now you've got MPs and various other concerned citizens writing in that these CoWIN glitches are a matter of great concern, that there are technical glitches that are being reported from, say, Maharashtra, from elsewhere, even now, as late as the 15th of February.
No, Sanket. Let me answer that question. I think this is very relevant. I can say that yes, when the Honorable Prime Minister launched that program on 16th of January, then for a couple of days there were glitches in the system, and it is quite natural, as I had said before also, that when you introduce a new system, there may be some small problems here and there which were fixed. Now I can say with guarantee that there are no glitches. Now what you are hearing or what is being reported in the media essentially are the data related issues. So as an example, if you did not enter the data, or if you did not really make an entry when the person came for the first time for the vaccination, right? The system does not know that this person has been vaccinated once, okay? And when the next time this person comes, then you start saying that the software is not allowing me to give the second dose. Obviously, system is working by the rule that the difference between the first dose and second dose should be 28 days or more. And if a person who has been given first dose will only be allowed to be given second dose.
Sure.
Now, if the system does not have the information relating to first dose, obviously it will not allow. So essentially what is happening, Sanket, is people are confusing the data related problems with the software glitches. That's the situation.
So having said that, Dr. Sharma, since you are a man of technology, let me ask you, this is a country which has done various mass vaccination programs in the past, much before apps even came into existence. Now, I'm not saying we go back to the, to the era of the dial-up modem, just as a point of conversation. But the point is, time is of essence. Time is real estate right now. So while we are trying to fix the app, why can't we go back to a tried and tested government mechanism of opening up the process of vaccination, and you can continue to fix this app simultaneously? Because see, we are wasting time.
No, Sanket, I told you this app is completely... No, sir. The app is already fixed. I told you that on 16th January, the whole thing was, the Prime Minister launched the program, and the app's glitches were fixed in the next 2-3 days. Now there are absolutely no glitches. So I don't know how you are drawing the conclusion that we are busy fixing the gaps. There are no gaps at all. And number one. Number two, please understand, this is not immunization. This is actually a many multifold, scale higher problem, larger problem. It's a problem of a magnitude higher than whatever we have done in the past. We have our population 1.3 billion people, and even if you take out the people with 50 years plus, that number also is of the 270 million, 300 million. Now that part, and when you are going to have 2 doses, and there is a accountability issue that the person who has had 1 dose of one particular medicine, vaccine, the same vaccine has to be administered to him next time.
Correct.
So you can't manage this without use of technology.
Correct.
So
while I agree with that, Dr. Sharma,
kind of
I agree with what you're saying. I agree with what you're saying, Dr. Sharma, but sometimes, technology is to help us and facilitate the process. Will there be a system embedded here that, say for instance, if there is a glitch, it can happen. See, because humans are going to use this technology, can there be an override? For instance, someone who can authorize an override, something that can override this app.
And any technology applications, technologies, as you very rightly say, are made for facilitating the process. technologies are made to effectively and efficiently implement policies. Technologies are not made to ensure that, those policies, technology does not obstruct these policies and should not obstruct the policies. And lastly, exception management must exist in every kind of technology, because you are very right, things can fail, connectivity may not be there, or some other things may happen, and we are a country of a very, very diverse nature. There are places where you have all kinds of connectivity, there are places where there is a lack of connectivity, and therefore you have to have an override. I completely agree with you, and you have to have, so essentially technology should facilitate you.
Absolutely.
Technology should not really obstruct you,
now,
and there should always be a mechanism for overriding or, absolutely.
Sure. My last two questions, Dr. Sharma. I'm asking this question again with great responsibility, because a lot of people are waiting for vaccination process to be expedited or the speed to come in. Our current average is 3 lakh vaccinations per day. Obviously, we are vaccinating the frontline workers. To be able to achieve our vaccination target of 30 crores, say in a period of 6 months, we would have to be in a situation where we vaccinate about, I'm extrapolating, about 20 lakh people a day. Do you think that your app will be ready to be able to deliver this?
Absolutely. App will not be a constraint. Let me also inform you that 10 years back, as early as in 2010-11, this country had done Aadhaar enrollment. And we were doing 2 million enrollments per day. And the technology supported that. So that is not a question at all. While, you might, people might question the capabilities, we are very confident that we have made billion scale applications. And when India makes we have made UPI, we have made Aadhaar. It's not, we are aware of the responsibility, we are aware of the scalability, we are aware of the speed. So applications will not come in the way. As far as the numbers are concerned, you are free to make your assessment. And my sense is that we are going to have a huge scale up very soon.
Okay. You're saying soon, and you've also said that this is not your decision to take, this is an executive decision. But let me ask you this question again. And I'm trying my luck, asking you a question in different ways, Dr. Sharma. So the health minister is saying that frontline workers must get their dose by the 6th. If Dr. Sharma is told by Dr. Harshvardhan or someone in the government, get your app ready, we are starting tomorrow, will you have the confidence to tell the government, go for it?
Absolutely, absolutely. There's no, I'm absolutely ready. Let me tell you, we have made these applications, we are doing the in-house testing, but if we are told to deploy it tomorrow, we will do that. That's not a problem at all. With regard to the numbers, I was just saying that my personal opinion is that we are going to have a scale up very soon. I'm not giving you the exact numbers and the exact date from where those things will start. But if we are told tomorrow, sure enough, we are ready.
All right. Dr. Sharma, many thanks for joining us.
Thank you very much.